Hi everyone, we now know in detail about the anatomy of external ear, middle ear and inner ear. We have also learned about the various disorders of ear, right? And also about the physiology of hearing and equilibrium. Is it enough for you to become a successful otologist? No, the anatomy of middle ear, external ear and inner ear is not enough. You also have to know about the anatomy of facial nerve for you to become a successful otological surgeon. Why? Because the anatomy of facial nerve is intricately related to the anatomy of the middle ear. Okay, now what is this facial nerve? Facial nerve is a mixed nerve, so it has got a motor component as well as a sensory component. Now, how does this facial nerve arise? There are various nucleus associated with facial nerve that you have to know about. What are they? They are the brachiomotor or simply the motor nucleus, which is the part that deals with the motor part of the facial nerve. Okay, and this motor part of the facial nerve is being supplied by the cerebral cortex. Okay, the precentral gyrus of the cerebral cortex has been going to the facial nerve nucleus from the opposite side. Okay, and as you can see here, it is crossing over from the opposite side and supplying the facial nerve nucleus. Okay, it is going through the internal capsule, the genu of the internal capsule, and finally it goes and reaches the facial nerve nucleus, which is situated in the pontomedullary junction. Okay, it is situated in the pontomedullary junction. And what are the other nucleus you have here? You have the visceral motor or superior salivatory nucleus. Now you remember, the superior salivatory nucleus is a part of the facial nerve. What about inferior salivatory nucleus? It is a part of the glossopharyngeal nerve. Okay, superior salivatory nucleus is seen in the pons, whereas the inferior salivatory nucleus is situated inferiorly, so it is seen in the medulla. Okay, and the superior salivatory nucleus deals with the secretomotor supply to the submandibular and sublingual salivary glands, whereas inferior salivatory nucleus deals with the supply to the parotid gland. Actually, here it has been reversed. Okay, the parotid gland is situated superiorly, but it is being supplied by the inferior salivatory nucleus and the glossopharyngeal nerve, whereas the submandibular and sublingual glands, which are situated inferiorly, are being supplied by the facial nerve, which has got its nucleus superior, and hence it is called superior salivatory nucleus. Okay, now the nucleus tractus solitarius conveys the special sensory, that is the sensation of taste being conveyed by the special sensory nucleus, and it also has got a lacrimatory nucleus. Why? Because it is the part of geniculate ganglion that deals with the greater petrosal nerve, which goes on to supply the secretomotor fibers to the lacrimal gland, and that is important for hearing. Okay, secretomotor fibers to the lacrimal gland are coming from the lacrimatory nucleus of the facial nerve. Okay, now what are the various fibers associated with it? You have the, first of all, you have the special visceral afferent fibers. These are special sensory, right? So here you have special visceral afferent. Okay, and from the superior salivatory nucleus you have the general visceral efferent. Here you have the general somatic efferent. And the general visceral afferent nerve fibers deals with the normal sensation. Okay, that is the facial nerve. I told you it has got a motor part and a sensory part. The sensory part is going through the nervus intermedius or the intermediate nerve. Okay, so this nervus intermedius has got its fibers coming from the facial nerve nucleus through the general visceral fibers. Okay, these fibers are the ones which supply the posterior superior part of the external auditory canal. You remember the Hitzelberg sign I told you about. Hitzelberg sign is due to this nerve supply. Okay, Hitzelberger sign. Okay, so now we will be going to the details of the facial nerve. The major part of the facial nerve is motor, and this motor part is coming from the motor nucleus. And how is it coming? There is an intracranial course, right? First of all, there are UMN fibers going on to supply the motor nucleus. Okay, and as you can see here, there is bilateral representation of the upper part. Okay, there is bilateral representation of the upper part, whereas the lower part is being supplied only by the contralateral side. Okay, so that is the reason why in case of UMN lesion, the frowning is not frowning is actually spared. He can frown, but the angle of mouth will be deviated to one side. The reason is because of the bilateral representation. Okay, apart from that, another thing is that the facial motor nucleus is having another supply, another UMN supply, that is coming from the thalamus, which is independent of our voluntary will. It is occurring in response to when you see a person you know, there might be an involuntary smile coming in your face, right? That is occurring because of that. Okay, so that is why in UMN lesion, even if the lesion is in the pathway of the normal voluntary pathway, the patient will be able to smile. Okay, because the thalamonuclear fibers are spared in that case. Okay, because when you are emotional, the smile won't be lost. Okay, so that is one thing that you have to know about facial nerve. Now coming to the intracranial course of the facial nerve. The intracranial course of facial nerve starts with the facial nerve nucleus in the pons. Okay, it starts with the facial nerve nucleus in the pons. I was now talking about the UMN fibers. Okay, UMN fibers, there are two types. The type upper part being dealt with by bilateral representation, that is from the same side and also from the contralateral side. Okay, from the post central gyrus. Okay, which has got the facial representation. The lower part has got fibers coming only from the lower part has got only fibers from the contralateral side. Okay, so these are the things that you have to learn. Now coming to the intracranial course of facial nerve. How is this facial nerve going on to supply the various muscles of the face? Okay, as you can see here, this is the area of the pontomedullary junction. From there, the facial nerve arises and then goes into the internal auditory meatus. Okay, internal auditory meatus goes into the internal auditory meatus, and through the internal auditory meatus, it goes along with the vestibulocochlear nerve. Okay, it has got vestibulocochlear nerve along with it while going through the internal auditory meatus, and that is how it reaches the temporal bone. Okay, so that part of facial nerve which is seen within the temporal bone is called the intratemporal part. So what are the parts you have? You have the intracranial part, that is from the motor part of the motor nucleus of the facial nerve. From that it starts at the pontomedullary junction till the internal auditory meatus. Okay, you have the intracranial part. It is about 15 to 17 millimeter in length. Okay, then you have the intratemporal part, which is further divided into 4. That we will be discussing in detail later on. And the third part is the extracranial part. Okay, so this is how you divide the facial nerve. Okay, so how is this intracranial part of the facial nerve going? First of all, it is starting as facial nerve nucleus, right? It is seen below the 6th nerve nucleus. This is the 7th nerve nucleus. It is seen below the 6th nerve nucleus seen here, and this facial nerve comes from the 7th nerve nucleus. It goes curving around the 6th nerve nucleus to form the facial colliculus, right? And then this is seen in the area of pontomedullary junction, and then it goes into an internal auditory meatus and goes on to occupy its antero-superior part. Okay, it occupies its antero-superior part. So this is the internal auditory meatus here, and it goes on to occupy its antero-superior part. Okay, now this part which is seen from the pontomedullary junction up to the internal auditory meatus, and that is what is called as the intracranial part. Okay, intracranial part, and this is about 15 to 17 millimeter in length. You have to remember the length of various segments also. Okay, that is important. And the meatal segment that is seen next is about 8 to 10 millimeter in length. Why? Because the internal auditory meatus is about 1 centimeter in length, so it will be 8 to 10 millimeter in length, right? Now how is it seen in the internal auditory meatus? You are familiar with this picture, right? You have the Bill's bar here, which is the vertical crest which separates the 7 up from the superior vestibular nerve. Okay, what have we learned? 7 is up and coca-cola is down. That means facial nerve is seen superiorly and the cochlear nerve is seen below. Okay, here we have the facial nerve, and it is being separated from the superior vestibular nerve by the Bill's bar. And who is this Bill named after? It is named after William House, who is the father of neuro-otology. Okay, all these things we have already discussed. I am just trying to revise those points, okay, because it has been asked for the exam. Okay, so we have the superior vestibular nerve superiorly and inferior vestibular nerve inferior, along with the singular nerve, which is a branch of inferior vestibular nerve which supplies the posterior semicircular canal. Okay, posterior semicircular canal. So that's about the meatal segment. What is the next segment you have? From the meatal segment, it goes on to a segment which is the narrowest segment as well as the shortest segment of the facial nerve, and that is what is called as the labyrinthine segment. Okay, labyrinthine segment. So you can see here from the part of the internal auditory meatus, it is seen within the temporal bone. Okay, so the whole thing is known as intratemporal segment. This is the intracranial part. Then it is seen within the internal auditory meatus. That is what is called the meatal segment. Then this part here, this is what is called the labyrinthine segment, and this is the narrowest part of the facial nerve. It is only 4 millimeter in length, and not just it is narrow, it is also the thinnest part. Okay, its diameter is only 0.68 millimeter. Okay, throughout the temporal bone, the facial nerve is having a covering by the temporal bone, and that is what is called as the fallopian canal. Fallopian canal. So if any edema occur in this area, the chance of the facial nerve undergoing hypoxia is more, because this is the narrowest part of the facial nerve. So this is the area where the insults such as Bell's palsy or any viral infection causing facial palsy, for example like the Ramsay-Hunt syndrome, all those are seen affecting this part. Okay, but Ramsay-Hunt syndrome is not affecting this area, it affects the geniculate ganglia. That is why the vesicles are seen. Okay, what I was saying is viral infections like Ramsay-Hunt syndrome. Okay, Ramsay-Hunt syndrome is being caused by herpes zoster virus, right? Similarly, herpes simplex virus also can cause a facial paralysis, or any insult which is resulting in hypoxia and that is resulting in edema, that is usually seen in the labyrinthine segment. Okay, labyrinthine segment. So labyrinthine segment is the narrowest part, and after reaching the labyrinthine segment, after the completion of the labyrinthine segment, the facial nerve takes a turn. That is what is called the genu. What is the word meaning of genu? The word meaning of genu is bend. Okay, you have learned about genu varum as well as genu valgum, right? In case of the knee joint. Okay, and this genu area you have the geniculate ganglion. Okay, and it is from this geniculate ganglion you have the greater petrosal nerve rising. Okay, all those things will be learning in detail later on.